morning, students. I want to share something with you today because regarding this subject, it is really challenging actually, but I also enjoyed it. Where to prepare a video for this particular subject, I nearly spent at least 7 to 8 hours to search lots of information, and then too for today's topic about paradigm shifts in marketing related to hospital sector. This is actually you cannot mostly find out in any other uh, presentations because I have combined two or three PowerPoints and I've edited something and then finally I've given a voiceover to the slides. So this is actually it will be useful for you whenever not only related to hospital management, wherever if you are going referring to any type of industry. Normally, paradigm shifts means wherever there will be changes every time. If there is any changes happening in that sector, we should try to adopt them. That is actually paradigm shifts. So every time, as we have taken again CRM in CRM, that is hospital electives. It is I don't know how many of them have really understood this subject actually, because CRM itself it is a marketing paper. So, how far it is linked with hospital sector? That is what we are studying. For that reason only, we are studying this paper. So, please understand that first of all, the two CRM in hospitals. So, you should very why they are every time adopting new changes. That is actually paradigm shifts. So, every time there will be changes happening in all over the sectors, especially as we are talking specifically about this hospital sector. We'll talk only about this. So the certainly we are talking about here setting personal records in a context of the paradigm shift. So in the coming next two slides, there will be some pictures actually. So these pictures actually where people are reading paper, that is left hand side of your slide is talking about every individual is reading a newspaper that was taken in the year 95 to 2005. And after the 2005, so everybody is having a personal device, that is mobile phones. They'll be keeping on seeing only the mobile phones. Please don't see only this picture. Whenever you are traveling somewhere, if you see, I have every time I'll be going in trains. You live this 4 months previously and all. When I go and sit in the railway station, everybody they're having a mobile phone and everybody is seeing only the mobile phone. They are not sharing anything. The person who is sitting next to them. So you see, please watch this one. 95% of people they take their mobile phones and they keep on watch only the mobile phones and they never talk to the person who is sitting next to him. So certainly we have put the word is all this technology is making us antisocial. So that is actually we are using a word called empowerment. So we talk about innovation, but whether it is really giving anything related to total freedom means no. According to uh, general topic, if you are talking, it is not correct. So, but let's look at the PHR in wider concept, that is the physical health ratings of how technology, especially at the digital end, is impacting on health. The next picture will be showing about this. Actually, sharing the screen with your the persons who are close to you. So these are all ideas I'm giving to you before entering into the depth of the subject. And here we're talking about there are lots of apps nowadays. Better than me, you people will be knowing actually what are all the latest apps. Either I don't know how many of them are using the apps which is very much useful for you. And I know about 80% of the students category they'll be using only the social media apps for entertainment purpose, but I don't know how many of them they are making it useful. But actually, as you're a PG student, you are learning. That's all. You are just if you are a UG student, I can tell that you are simply you can have lots of fun or entertainment activities. But in next 3 months, you are going to enter into industry. So when you are going to enter into industry, you should know many things. Generally, if you know about only the uh, entertainment activities, means it will not be correct. So it only here this second sentence for sending and receiving pictures of their grandchildren. Why do they use IT for at present situation? Reading the papers in digital form and shopping purposes. But the young people pictured on the metro using their powerful handheld computers. So that is what you people do nowadays. So simply take photos and share with many people, and there is lots of comments related in that social media and all. So this is actually now only we are entering into the hospital sector. This particular slide. So I don't know how many of them and all as you have taken hospital electives. So previously and all, if I want to go for a diabetes check, they'll be taking that is before food and after food. That is fasting and after breakfast. There is actually two categories. They should check the blood test, and to get the blood report, we should wait for nearly. If you are giving first, that is in fasting, if you are giving the blood by 6 o'clock, and after taking breakfast by 8 o'clock, and we are giving the blood that it will take again 1 hour. We should wait, and after taking the blood report, after taking your breakfast, and that report it will be we will be getting in our hand only by 10:30. So totally 4.5 hours. Now people were taking time to give a result, but nowadays it is not like that. So they are taking one method called random method. So random method and all for the past 3 months, what is your blood sugar level and all they can easily check. Very advanced technique. Catching. So only we have taken here about diabetes. That is, I don't know how many of them know is it. There is a phone app connected via Bluetooth to the device allows sophisticated monitoring of relevant measures by the patient actually. So one best example I'll tell. So one of my friend is working in Singapore. He came to India for his vacation time. So when he came for vacation, he was having some problem in health related issues. So he went and consulted a doctor, and he told that he's having a BP, and he has prescribed some tablets, and that too when he was prescribing the tablets, he told about this particular tablets and all we are getting it from different countries, so it will be very good for your health related issues, that is BP. So he has he has purchased the tablets. The cost of the tablets was nearly 3,000 for 1 month. And after taking the tablets, and again he went back to Singapore. And before joining the duty, and he told that in the organization that in India he's consulted a doctor and he has given tablets for BP. But again, in this organization in Singapore, they asked him to go and consult a doctor in Singapore, and that particular doctor has he didn't tell anything. He has actually tied one strip in his hand, like a watch. So that is what here we are talking here, actually in this slide. He has tied a strip in his hand, and he told that you please wear this strip for next to 24 hours, so that device will be monitoring your body and what is your heartbeat level, everything it will be checking for next 24 hours. And next day morning, he went to the doctor and he has removed that particular device, and he told that no, you're not having a BP. So in our present Indian scenario, if you go and consult a doctor, and that too, if you are climbing the stairs for two floors or three floors, and if you go and check your BP level, normally your BP will be high. Not only for me, even for students like you also, it will be there. So it is not like within one day everything will be defined. No, there are different techniques. That is what here very advanced. What I told is somewhat before 2 years before, but now in this slide you can see that is a phone app connected via Bluetooth to the device allows sophisticated monitoring of relevant measures. So what is happening in your body? So everything will be monitored. So the above technology mainly it is being created for the developers with diabetes 1 or with family members with diabetes type 1 means that has been taken from your family. So certainly I've given in this slide also it is being by sugar.com given by Frank Westerman. And if you refer this particular sites and all, it will be there what is actually a family. That is what diabetes type 1 means. You can check and where do they get their information from is if they need any support like that and all, it will be monitored and they will be sending the report to the particular hospitals. So that is what here one of my colleague actually in the coming slides we'll talk about that. So if you're having problems nowadays, so people mostly check. I don't know how many of them follow this. If you're having any problems in your health related issues, if you go and consult a doctor, if he's telling something, immediately we'll go and refer. There are lots of sites or lots of books. There are very good books. So here, why I'm giving this slide because there will be 5,000 members in your group. But if you're asking something, only 50 or 100 will be replying. And there are lots of issues also. This is our understanding of new paradigm in e-health because why we are talking about previous slide and this slide because please understand. So when you are posting something and if you're asking something in your social media group, in our social media group itself, in my mobile phone, I'm having school friend group. Two of them are doctors in the group and they'll be sharing many things if they are free. Please understand the word, underline the word. If they are free means they'll be giving some replies if anybody is asking any questions. But if they are very much, if they are very having tight schedule means they'll be giving only reply after 2 days. So some other people will be giving comments and even in midnight sometimes will be. I don't know how many of them is will be seeing that comments and all. If I didn't open that particular WhatsApp, I'll be getting in that group alone. I'll be getting alone. If I'm not opening, at least there will be 200 minimum 200 to 250 messages if I'm not opening in that WhatsApp group alone. So I don't know how many of them really. There are nearly 30 persons in that group. So out of 30, 10 members will be active. In every group, it will be like that only. The 10 members will be passing the communication and one or two if they're having knowledge they'll be sharing. So such as patients use of social media to communicate to each other for support. So normally now will now as a student you will be passing only your entertainment activities. But actually after some time you will be sharing some other information which is useful for your health related. So many things we can keep on talk about. So here are two caveats here. There are techno-savvy patients that is of different generation. So the person who are always having knowledge in technology and the person that is different generation means they'll not be having that much knowledge about technology. Every time, so if a techno-savvy patient means every time he'll be thinking of an alternate model because every time these people will be looking some sites and they'll be talking. One of my colleague also is like that only. And if he's having any problem, say for example, he's having some backache, immediately we'll go and refer at least minimum 20 to 25 sites. What is the reason for backache? Because he's a techno savvy person, as he's from basically computer science group. He will be taking the 20-25 sites, and next morning he'll come and share to us. So these are all the reasons why we are getting back pain. But the other generation people, no, that is different than generation people, they'll not be like that. They'll not be having much knowledge about technology, or they'll not be having knowledge about the, the any particular diseases and all. So, so next sentence is talking about the self-management. Equally, the good self-management that this new paradigm diabetes illustrate doesn't invalidate their relationship with their physicians, but it has the potential to transform it. That is what here we are talking about. Sometimes the persons are keeping their verifying some particular sites, and when they go and consult any doctor, no, so if doctor is sometimes telling some other reason, and the relationship will not be there in a smooth manner. So here, a new generation. So please see the read the text down which is there. So even in the 6 months itself, somebody else is typing in a mobile phone. He has texted his first word today. Previously, nobody was like that. So this slide is talking about so before the person who were born before 2007. I know that you people are having everything, mobile phones, all social media platforms and other platforms you're working. But sometimes the persons who are born after 2007, even at when the person is 6 months old, the kid is 6 months old, means at that time itself you'll be swiping his mobile phones. Please watch even at your residences if any kids are there, and there'll be any 6 months old or 8 months old or 1 year old kid also. If you give any mobile phones, he'll keep on something do with the mobile phone. That is simply swiping. One of my colleagues' daughter, she's having her own private channel. Her age is actually only 5 years. She's having her own YouTube channel and she posts lots of video, and there are lots of subscribers also. And she was sharing that in next 1 year or 2 years, they'll be passing on the benefits to the particular kid, it seems. So like that and all it is happening. That and all you people will be knowing. So you people would have been watching TV earlier, but now at the present generation kids and all, they're not watching TVs and all. They keep only phones in their hand or tablets in their hand, and we should think whether it is really a very good change. No, it is not that. So here we should talk only about the change in behavior. That is what here talking about a distinct change in behavior, like the diabetes example. So why this particular diseases and all is happening here? Because people are not going out and playing anything. I don't know how many of them are sportsmen in your class. So these slides and all will be talking about the health and healthcare systems. So giving people access to the health data, whether via PHR or access their EHR, doesn't in itself result in any significant incentives. So simple in one word we can talk about is whether the person is talking about their health, whether they can get the data or they can access the data, and they'll be nowadays it is very easy where people go and type something and they get lots of data in related to the health itself. So here The next sentence it is only for you people. I don't want to talk mostly about that because you people do that only for shopping, chatting with friends, and looking at media. So I don't want to discuss about them. But this this above first paragraph is talking about the persons who are really talking about or worried about their health sector. We hear about greater activation, but not better health outcomes. So in city, I don't know about how many of them know this. As a hospital management student, a very good management system related to customer relationship. Which hospital they are following is, I'll tell you that only if you go to Miyot hospitals. Miyot hospital is having an separate block itself for two categories. One block is for NRI, and the other one block is for Gulf countries. So Gulf countries actually, our India is very famous for medical tourism. So medical tourism means they never come here for any enjoyment. So please don't think tourism means for enjoyment. They come here for some medical reasons because our medical cost and all it is very low when compared to global market. Our Indian medical cost is somewhat low when compared to global market. So our medical tourism sector in India is very good, and the facilities here also provided in and that too mostly in Chennai. There are very good facilities provided for health related tourism and all it is there. So here, please, why I'm using empowerment means empowerment is actually a paradigm shift. So it is a term used in commercial sector and in the policy world in a way that has almost rendered it as meaningless actually. So commercial sector means okay, people will be talking, okay, we have given lots of empowerment to customers. So but here mostly patients get angry because they don't see any sign that the traditional basis of, please underline the words, power relation between themselves and healthcare professionals. So seen also in one fields, even prescriptions or the doctor's prescriptions and all is being sent by mails only. I don't know how many of them knows it, but actually in a film also they have shown. If you want that, please go and refer in any big hospitals. Prescriptions are sent through only mail, so patients have never or not having the opportunity to talk with the any physicians. So people actually has changed much. Technology might be good, but still old paradigm with shiny new toys. Please, this is actually people in health sector that is actually about talking about the persons who are in the age group of about 35 or 40 also we can take, but still old concept, but young people only they enjoy whatever the new methods are being implemented in the health care systems. So this is actually this is what related to one publication, how people were really satisfied with the help of new paradigm shifts in customer relationship. Talking about here in the briefest possible terms, the model was developed. That is three points we'll be discussing of paradigm shifts: education of both patients, either literacy and professionals, that is like in empowerment skills, then joint decision making and self-management, especially if any for long-term conditions. Say for example, if the patient is there for coming to hospitals for the past 5 years or more than 10 years, how far you are going to maintain the relationship with the patients. So educating the patients is very, very important nowadays. So we should tell him what really diseases and what is it they are going to do and what are the problems they'll face. And after educating them, so joint decision making both by the family of the patient and by the doctors, they'll be taking decisions and the self-management. So self-management means, so if you are going to maintain a very, if compulsorily nowadays no doctors, if one patient is going out, okay, no need to come, nobody will be telling. So how they are going to maintain the relationship for the next coming days? That is what mainly brackets we have put long-term conditions. So normally we'll be talking about this study was conducted in more than 20 countries. So looking at the barriers and facilitators to the patient empowerment and all. So in these three areas only they have conducted research and in most in more than 20 countries they have conducted. And, what is the health outcomes and all they have done. So convincingly that shows that good practices in these three areas do produce better health outcomes. So one is actually talking about educating the patients, then joint decision making both by the patient families, family and the management, that is hospital management staffs, and the final thing is self-management system. If these three things are being carried out, the patient empowerment will be very good it seems. That is what the research has been shown. And one more thing, the top four facilitators identified by the patient was actually professionals having enough time. This is main, have enough time to communicate properly with the patient. The health professional should have a holistic view of the patient. So this point is talking about second point is talking it's not talking about just the physician should not come only check the patient and just go away. So at least he should spend time with him for 15-20 minutes talking about his personal information and talking about something which the patient really enjoys so that they can be very much close to the patient and they'll be very much satisfied. For that only they have given holistic view of patient. And then integrated and coordinated health or sorry integrated and coordinate health and social care. So both not only we should not talk only about health, both health and social care should be given should be integrated. That is what this point is talking about. We should take also health is important, but not only health but also the social care. So some patients and all will be very much satisfied, even though the doctor is taking only the patients will not be satisfied. Sorry, if he's completing within 5 minutes. So some patients expect the physicians to talk with them for 15 to 20 minutes and share something about their views about the diseases which they are having. That is what here the health and social care should be coordinated and also integrated. The patient feeling responsible for their own health, they should give that certainly uh, educate them. So it is very much we'll be very much talking about soft skills rather than technology. So this slide is talking about more than the technology. That is soft skills means talking, communication. Simply one more thing we'll be talking about here is the messages from studies such as this are very clear. It is not only just patience or the change of the behavior, we are able to talk realistically about empowerment. So simply in three words we can come to conclusion that education, education, education. Even when you are going for tech savvy, so you should educate how far uh, the tech is helping you. That much knowledge we should give. That alone it is duty of the hospital management staffs. It will not be given by the physicians alone. There are lots of other hospital management supporting staffs. So this is what will happen in future. You, lots of people are browsing nowadays and knowing many things. One doctor is communicating to his colleague that the patient knows more about the diseases than me. Not only in this field, in all the fields. So I should get better, faster modem, higher speed internet access than the patients. That is what nowadays it is happening. So previously and all, doctors will write something, prescriptions and all is not like that nowadays. So patients come and tell something, I'm having this, and I browse this particular site and it is showing this. If this symptoms is there, I'm having this disease, what should I do? Like that, and all people come and ask their doctors. So this is what here India needs a digitally smart and smart health workforce. So on the here, digital health workforce means digital technology, e-health, telemedicine, electronic health records. We are having 2 points here. Very good points. We are having electronic health records and digital technology. But telemedicine and e-health, we should have lots of, we should give, in future it will happen, but at present situations, it is somewhat low. Only 10% of people know about e-health and telemedicine sectors. So employers, education and training providers help professionals to work together to boost investment in digital skills. So it is there nowadays in other sectors. There are happening going, lots of happening is going in. But health related sectors from the customer point of view. I'm not talking from doctor's point of view. Doctor's point of view, they're having lots of technology to give various facilities. But from talking from customer point of view, still many people don't know about the digital technology. Many people know about electronic records and all, but digital technology and e-health and all, and nobody is having that much awareness. So again, they should go for multidisciplinary terms to deliver integrated care. That is actually increasing deployment of cross specialists. Nowadays, nobody is willing to go for only the doctor who is a single specialist. They want to go for one particular hospitals which is having multi-speciality hospitals nowadays. They use the term multi-speciality. Cross specialist, if you're not able to understand, so you can understand, you would have seen this word multi-speciality hospital where there will be doctors for all categories. So that is the main thing, and it should also be patient care, centered care, importance of soft skill. So just to market nowadays and strengthening health professionals competencies in public health and prevention. So these things and all we should be concentrating in the health sector. First point, please understand, every time we should employ multi-speciality teams to provide integrated care. So the I told no decision making, the future of decision making, soft skills in action. So you should have lots of options and what are all the benefits, harms, risks, and all you should tell to the patient, and the patient can decide. So which one is very good? So A, B, C, D, and all. With different types of therapy, and you should tell each and every therapy what is the benefits, harms, risks, and what is the cost, everything, and the person, that is the patient or the customer. So we should not tell a patient, customer can decide what therapy he is really interested. So this is what it is happening now, but many people are not aware, or not having awareness. So these are all, it's an added slides for added slide for you, where the person nowadays, where not more than 5% budget is spent on prevention rather than treatment. So that is what the major problem here. So nobody is after coming after if any problem only they go for a health checkup and other thing. but when they are normal, they never go and spend anything for health. So every day, I don't know how many of them in your family go for a medical checkup every year. So only we can see 5% of the people are going for it. And health system where the focus of care in the community, not in a large institution. So this is what we're talking now, where people are not very much interested, according to mainly in our Indian scenario, uh, only after if they're having any problem in the in their health, they go for focus of health, or else they never bother about it. So here, health system as a patient, if they're able to take responsibility for their own health and professionals act as coaches, that is what here. So nowadays, doctors, when you go and consult with any doctor, private doctors, I'm talking about any private physicians, and if you are ready, if there is any problem related to your health, they will really market what is the real problem and what is that they will be doing, and from your side how much budget you should spend. So actually, the coach is the person who really motivates you. But here, because of our Indian marketing conditions, it is totally changed. So, so we are talking about genuine innovation. So new devices that should enable the change rather than support the current paradigm. So that we know that is a very tough call, especially as there are all kinds of Western influence that want to maintain the status quo. So I want to just complete one minute. So when I was talking to my neighbor, so he was facing some problem related to health. So when I asked him, so how was the treatment given by that particular doctor or particular hospital? And immediately he got tensed, and he told that all the hospitals or simply they are looting. But actually I told that no, all the hospitals are having very good technology and there are very good doctors. But the proper approach is not being done, so only uh, you're not being treated. So you should actually consult any proper channel. That is what I told him, and still he was not satisfied. This why I'm talking about this because this particular word it is given here tough call. So many things will be happening in health sector if you go and work there. Unless until you will never be knowing what is happening. At least if you have gone for any with or with your friends or family members to any very big hospitals, you know what really is happening there. You will be knowing what is it real technology they are having. So I'll finish with this example. One of my friend's brother. Maybe I am actually from suburban. You people are coming in. You people are in city. I am from suburban area. So he was one one particular night he was having some problem, and we have taken him to a doctor, and the doctor told he's having kidney stone. So immediately he should do an operation. So and for that operation, the cost will be coming around 50,000. So next day morning, so he was planning to admit in that hospital, and somebody else came and told why you can't go to any city hospitals. He told. So he was having little bit confusion, and later he decided to go to one famous hospital in Chennai. And he told that, and he has consulted with one famous doctor for urology. And he told that there is no need for any operation, a tablet is enough for that. And same cost, without operation itself, talking about the various tests. and what is the food you should take and what is the food you should not take. Every report has been given to that particular patient, and he has consulted the doctor, and he has given also the prescription. Within 2 days, the stone came out without operations and all. This is what actually the technology is there. So if you are consulting very good doctors, they'll be having lots of ideas on what you should do and what you should not do. A detailed report. This is what really education is in the health sector. But in my place in suburban area, no, it is not like that. Immediately, if there is any problem, and if they're finding out any stone, immediately they will tell operation. So, but cost for what you are doing for the operation here, surgery, and what you have done for test, various tests in the hospital is equal. So, but our health is safe now. If you are doing surgery, there will be sometimes lots of issues after that. So that also it might be reason. It was here the, this slide, this cartoon is talking about lots of issues. Okay, so talking about various. Please understand this slide. Unless personal health, electronic health records align closely with people's attitudes. So everything should be coinciding. If anything is not coinciding, it will be a difficult task. So in Indian type of environment, so it will take another 10 years to match people's attitudes, joint decision making, self-management practices, and identified information needs. Everything is actually, it will take some time because to educate a customer in health sector is very, very difficult actually. First of all, you should be able to understand in that particular area. So if he's not having any interest means giving education is very, very difficult. So please understand, and according to that only we can make a paradigm shift. Paradigm shift is actually mainly talking about three areas. Already we have seen that. So here talking about this slide is talking about so full of technical only. So with this we'll be concluding the paradigm shifts. This slide is talking about very brief area about paradigm shifts in marketing. Mainly, please understand three concepts. One is uh, educating the customer, joint decision making, and then finally the self-management concepts. These three things you should develop in related to paradigm shifts in health sectors. And one more concept we are studying is education, education, education. So in in these two areas, if you are concentrating the paradigm shifts in health sector, it will be very good. Thank you, students. Again, we will see the Saturday, I don't think so because it is Vinaya Chavithi. So we'll see in the coming class. Thank you, students.